right. Welcome everybody to our final week of the Plant Powered Challenge. We're so happy to have you with us today. And tomorrow we have our very last webinar, so please join us tomorrow as well. I'm super excited about today's session. I actually saw Dr. Pathak present at the American College of Lifestyle Medicine Conference in this last October and was just blown away by the presentation. And we thought we have to have her on for the Plant Powered Challenge to share the information with you all as well. So Dr. Neha Pathak is board certified in both internal medicine and lifestyle medicine. She works as chief physician editor for health and lifestyle medicine and host of WebMD's Health Discovered podcast. She reports on topics related to lifestyle, climate change, and environmental impacts on health for WebMD and Medscape, and is a regular contributor to Yale Climate Connections. She is a member of the American College of Lifestyle Medicine Board of Directors and chair of the Global Sustainability Committee. Dr. Pathak is also a lecturer at the Yale School of Public Health, where she facilitates coursework on climate change and health. She's a founding member of Georgia Clinicians for Climate Action, and she has been invited to join the National Academy of Medicine's Communicating About Climate Change and Health Project expert panel. Through all of her work, she hopes to educate healthcare professionals and the public about the health impacts of climate change and environmental pollution and the health benefits of climate action. She lives in Atlanta with her husband and children. So without further ado, we're so excited for your presentation, Dr. Pathak, and take it away.
All right. Thank you so much for having me. And I will jump right into plant power for personal and planetary health. So I hope during our time together, we come away with a few things, and I hope by the end, we understand the severity and urgency for addressing the planetary health and climate crises, and that we're able to speak with others about the severity and urgency and maybe do a little bit of myth busting. We also want to describe how lifestyle medicine and interventions, and for our purposes today, specifically plant-rich diets, improve health for individuals, communities, and the planet. And we'll explore strategies to incorporate nutrition prescriptions that protect health, individuals, communities, the planet, with specific considerations about health equity. So essentially, I'm hoping that we come out of our time together with what you're already doing, likely, which is thinking about nutrition, food as medicine for our health, and just sort of expand that and think about food as medicine, not just as important for human health, but about the changes that we can make today to protect planetary health as well. So just to take a step back, planetary health may seem like sort of a new concept or something new that's in the literature or being described along with climate change, but really it's the concept that goes back longer. Some folks call it One Health, different sort of umbrella terms, but essentially it is the concept that human health depends on the health of the world around us, and that's incorporating the health of the water around us, the air, our agricultural practices, soil health, pollution that we are exposed to, along with climate. The climate is just one piece of it. So this is, in terms of planetary health, again, just thinking about planetary boundaries as a framework or a set of limits that scientists estimate that we need to stay within to make sure that we have a safe operating space for humanity now and into the future. So a way to sort of understand this graph is to see this central sort of dotted line where the green area is using several different components. So thinking about our climate, thinking about our atmospheric sort of components, thinking about our land system, fresh water, nitrogen, phosphorus cycling, and trying to stay within that green zone. What we recognize, or what the scientists recognize, is that there are certain areas beyond which we get into sort of a yellow zone. So we don't quite know whether or not we're in a safe operating space. And then when we get into the red area, that can be a range that is considered unsafe or unsustainable. And this graph is from 2009. So what I'm showing here is 14 years later. So in 2023, where have we come with regards to the planetary boundaries? So in pretty much every one of the limits that were sort of considered by the scientists as they developed the planetary health sort of boundaries and concept, we are currently living on borrowed time. So we're outside of the boundaries for most of the planetary safeguards. So what we often hear about and what we are really thinking about, I think, as communities across the globe is one particular piece of the planetary health crisis, which is climate change and its effect on health. So we have this report called the Lancet Countdown on Health and Climate Change that's been coming out for every year for over a decade at this point. And over the last several years has been really coming out to say that climate change in particular is one of the planetary health risks, is a code red for a healthy future. We have millions of lives at risk from the worsening air pollution that's accompanied by climate change, hundreds of thousands of deaths that are associated with excessive red meat consumption, which also plays a role in worsening climate change. And we would have significant, massive improvements in physical and mental health were we to protect the natural world around us. So a lot of times folks will say that this health concern is not grounded in science, or where is the health literature that suggests that we as healthcare professionals should be concerned about climate change. And we can then point people to hundreds of medical journals across the globe that the editors essentially have come together and starting in 2021, they had an update in 2023 that shows the evidence that climate change is amongst the greatest threats to health, and that as health professionals, we have a role to play. So I show this image because I think that this is one of the standard images that's shown to help us understand the connection between greenhouse gases at the very top all the way down to the health impacts of climate change. Now, what I think most of us see when we look at an image like this is overlapping, interconnected risks. There's a lot going on, and it really feels just overwhelming. It's hard for us as individuals, it's hard for us as health professionals to see how we fit into all of this chaos. It's also really hard to understand how we could bring something this big, such a huge problem into our exam rooms. And I think that I want to honor that sense of overwhelm, because it's absolutely something that I feel and many others who spend a lot of time thinking about climate change and health feel. So a completely understandable reaction. So let's move away from that image and bring it back to something that as health professionals, or even as people concerned about our health, we recognize as something that is in our lane, something that we can have some control over. So here is a normal EKG. This hopefully will bring our stress level down because it's something that we do recognize as in our lane. And when we review a normal EKG, we see that it has this sort of regular rhythmicity. It has a cadence that we can sort of expect to continue over time to suggest that the health of this patient is stable. We see dips, we see peaks, but a regular rhythmicity. But we recognize that when that pattern is significantly distorted or deranged, like we're seeing here with this peak I've highlighted here as an ST elevation. So this is a big shift and a massive change from that regular cadence that we saw. And so this denotes to us a medical emergency when we combine this finding with the symptoms, chest pain, shortness of breath, diaphoresis, sweating, we recognize that all of this information together means that there's a medical emergency going on, that there's a closing window of opportunity for us to take action so that we can save this patient. But we also know that we have the tools, the techniques, the knowledge to come together as a team to save this person, to protect this person's health, and to stave off the worst impacts. So I'd like to shift us a little bit now and think about this planetary EKG. So what we're seeing here is similar to the EKG rhythm strip, a rhythm strip of the planet's carbon dioxide levels over hundreds of thousands of years. So you can see it going back all the way 800,000 years through ice core samples. And what you see similar to an EKG, it's not static. We have dips, we have valleys, we have sort of somewhat, it's not as beautiful and rhythmic as the EKG, but certainly there is somewhat of a cadence and rhythmicity. And this is what we're seeing today. So a massive derangement that's happening over a very short period of time, and something that certainly human beings, but also the atmosphere of this planet has not seen in over 800,000 years. And this is coupled with symptoms of extreme heat, extreme weather events, flooding events, wildfires. So we're seeing symptoms plus this derangement that should signal to us and that do signal to the medical community that this is a health emergency. And we have a closing window of opportunity to save, in this case, the patient is really us, the population of human beings living on this planet. And the good news here as well is that we have the tools, the technology, the knowledge to come together to really protect and stave off the worst impacts of this changing climate. That's really essentially happening because of the increased amount of greenhouse gases in our atmosphere. So here I just want to take a little bit of time to reflect back on our EKG example and help us with some myth busting. So what you often will hear is people say, well, no, carbon dioxide levels in the atmosphere change all the time, or the temperature changes all the time. Would we ever accept that in our EKG example? So yes, EKGs do shift over time, but we recognize there's certain patterns coupled with symptoms that are dangerous for our health. And that's what this example with the carbon dioxide levels in our atmosphere is showing us. Yes, these levels have shifted and changed over time. That is 100% accurate. But we're seeing a significant derangement and a pattern that we've never seen in over 800,000 years of data. Another thing we'll often hear, just thinking about what people often say in the face of climate change is, well, we'll have some future technology that'll save us and protect us. Now, thinking back to our EKG example with the massive derangement, we would never suggest that if someone comes in with an EKG that looked like that, a massive heart attack with the symptoms, that, oh, at some point there'll be some technology that will fix this person's heart. We recognize that this person, every minute we waste, time is muscle. So that's the same sort of thought process that I hope that we can help people see when we think about the shifting climate. Every minute counts, time is temperature, and we have to have some sort of intervention to protect the health of our patients right now. Now, I hope that has shown you why we should all care about climate change and the planetary health crises, and given us some examples of ways that we can address some of the misconceptions that people might bring up to us and with us with regard to why we have some time to wait, or this is not that big of a deal. I'd like to take it a step further as people who are really concerned about food as medicine, as people who recognize the importance of the food supply on our health, really recognizing that climate change as it stands, our current state and what is likely to happen in the future is the worsening of that current state from extreme temperatures to extreme rainfalls, hurricanes, floods, droughts, wildfires, the changing in our seasons have diverse impacts from the production to the consumption of the foods that we eat. So what we see is generally significant effects on food supply, food costs, effects on labor, effects on infrastructure. And what that means in our day-to-day lives is essentially headlines like this. Higher food bills, vegetables, nuts, berries end up costing a lot more because of these extreme weather impacts. We see a lot more damage to our agriculture sector because of climate change impacts. And that has real world effects. And these are things that we're seeing in our world today and likely to get worse over time. The other thing I want to bring your attention to that we don't hear so much about, but I think is very important, another very busy slide, so I will clean this up. But essentially, this slide is showing us what happens with elevated greenhouse gas levels. So we have elevated amounts of CO2 in the atmosphere. And because of our planetary health degradation, soil nutrient changes. And over time, what we see is that yes, plants are, in general, because of elevated CO2 levels, getting bigger. When we don't have problems with the supply in terms of extreme weather impacting our agricultural sector, the yields are actually higher. But it turns out that higher CO2 in the atmosphere is actually not so great for the nutrient quality of our food. So just to clean that image up again and sort of take out a lot of the middleman, what we see is the elevated levels of CO2 have an impact on certain crops like wheat, rice, legumes, vegetables, a lot of the crops and the foods that we recognize as so important and so critical for human health. And what we see is that with these elevations, there's a decrease in iron content, zinc content, copper. In a study that was led by a researcher who's really been at the forefront of the planetary health movement, Sam Myers, he did some research to look at what happens to food crops like wheat, corn, rice, when they're exposed to CO2 levels at the levels that are predicted for 2050. So just about 20 years from now. And he found that plants can lose as much as 10% of their zinc, 5% of their iron, and 8% of their protein content. And we know that these are essential nutrients for people's health, particularly for the health of people in developing countries where these foods are actually fundamental to their diets. And where already we see deficiencies in zinc, iron, and protein cause major burdens of disease, from maternal mortality to problems with brain development in children. So if we anticipate reductions in zinc, which is a mineral that's crucial for the proper functioning of our immune system, or reductions in iron, again, a component in healthy building blocks for hemoglobin, that the molecule that moves oxygen around in our bloodstream, this can have significant impacts with regards to population health. So just to sort of bring this piece back to us, so if we are concerned about crop yields and crop supply in the face of climate change, and we recognize that the quality of the micronutrients in our crops are also likely to be affected, putting it into our current context helps us understand why this can be such a big problem. So we already know, so our current state is that half the global population is malnourished. 2 billion people are micronutrient deficient. An additional 2 billion people are overweight and obese, but are malnourished. with a global prevalence of diabetes that's almost doubled in the past 30 years. So our starting point right now, in the face of climate risks and planetary health risks to our food system, is quite staggering when we think about the potential health risks. So moving on to my favorite lifestyle medicine pillar, and I assume yours as well, the nutrition pillar. So I'd like to just dig a little bit deeper into our current state and see why our current food system is not necessarily setting us up for success. And then we'll end with what we can do as health professionals and how we can leverage our food system to actually be a huge lever to improve climate and planetary health. So first, this is not news to anyone here. Human health impacts, I think you've over the course of the last few weeks have discovered and discussed all of the health benefits of a plant-rich diet and the health risks of the opposite, which is the standard American diet. So we know that the diet that we have here and that we're exporting to a lot of developing nations is filled with red meat, processed foods, and is linked to obesity, heart disease, stroke, diabetes, certain types of cancers. So fundamentally not optimal for human health. We recognize that this is a great paper, and I can send a link to this for folks that are interested, but we recognize that this obesity crisis, this crisis of diet-related disease, is not happening in a vacuum. We also are facing a crisis of undernutrition in many parts of the world at the same time as an obesity crisis and a coalescing crisis of climate change. So this is a great paper that sort of thinks about all of those shared drivers and the shared solutions to address these common problems. And just in the United States alone, 70% of United States adults are overweight or obese, with 60% of those who are overweight also fitting the category of being malnourished. So now let's sort of really dig into what our current food system is doing to our climate and planetary health systems. So I think when we think about greenhouse gases, climate change, a lot of times the focus is on non-food sources. So we're thinking about fossil fuels and our fossil fuel infrastructure and what do we need to shift to renewable energy. And that is all really important. But I think what doesn't get as much attention, but should, is that 26% of global emissions that are coming from our food sector. And I've highlighted here with the yellow arrows which part of that. So if we're sort of to break out those 26% of emissions, and that's by some estimates an undercount. Some estimates would sort of suggest that greenhouse gas emissions, if you include indirect emissions, are as high as a third of global greenhouse gas emissions. But when you look at it, when you break it down, livestock, crops to feed the livestock, and land use for livestock account for a staggering 53% of the emissions from the food sector, just from animal agriculture. So this image is meant to show sort of when we think about animal agriculture and compare it to greenhouse gas emissions across the supply chains for a variety of foods. We recognize why, or the fact that beef, lamb, mutton, certain dairy products like cheese have just a staggering greenhouse gas emission capacity across the supply chain when you relate it to plant-based foods. So for about a kilogram of peas or bananas or maize, you are essentially producing about a 1 kilogram carbon dioxide equivalent. For 1 kilogram of beef, you are producing 60 carbon dioxide equivalents. And so you can see that there's just a massive disparity between where our carbon is coming from. And something that I always find very interesting is people often think about packaging or transport playing a major role. So they think, well, if I eat local, that may be better than eating from, something that's transported from far away. And what this data shows us is that it's really much more about what we're eating than where the food is coming from. So I'm not suggesting we shouldn't worry about eating local, but it has a much, much lesser effect. The packaging, the transport, when you think about just the greenhouse gas burden embedded in ruminant, particularly sort of ruminant animals. And a lot of this burden is increasing because average per capita meat consumption is increasing. As we've talked about, we are exporting sort of this idea about increasing meat consumption. It feels to many in the developing world as a sign of wealth and abundance. So as these countries grow into middle income and have higher rates of folks that are high income, we're seeing a shift in increasing meat consumption. And here I've broken I found a graph that helps us look at greenhouse gas production from protein sources. So often we'll hear patients and people talk about, well, we have to get our protein from somewhere. And I'm sure that you've talked about optimal ways of getting protein from plants. But again, this graph is just to show us that there is a significant greenhouse gas burden when we're thinking about meat sources, particularly red meat sources of protein versus plant-based sources of protein. And I do want to take just a minute here to talk about cow burps. So just a word on cow burps, because I think that this is another thing that we can help educate folks around. Generally, people attempt to minimize or sort of can't understand why cow belching or burping plays such a major role in greenhouse gas emissions. So this graphic tries to help us dispel some of those myths. So essentially, cows burping release methane. So methane is emitted from the anaerobic digestion from cows when they eat. So they can take grass and other materials that they eat, and they can actually digest it in a way that becomes usable energy, which generally humans can't. But that process, that anaerobic process, produces a large amount of methane. Methane is a greenhouse gas of concern because it has much higher impact. It's shorter lived than carbon dioxide in the atmosphere, but it's a much more potent, much more powerful greenhouse gas. So according to the Intergovernmental Panel on Climate Change, if you're sort of thinking about the potency of methane compared to carbon dioxide, it's 28 times more potent just because of the greenhouse potential in the atmosphere over a 100-year period compared to carbon dioxide. And then when you think about where are the major sources of methane, in the US, about a quarter of our methane emissions come directly from livestock. Most of it through the belching of cows, and then also some of it from the liquid storage of animal waste, which also emits methane. And then this can also help us sort of understand when we think about the biomass on the planet, 60% of that biomass is now livestock. So that's a lot of cow belching and a lot of methane production, which is why we're very much concerned about it as a source of greenhouse gas. by far not the only reason that we worry about greenhouse gas emissions from livestock. There's also land use change and other things that we can talk about. But the methane production is a major source when we think about the numbers of livestock across the globe. So, and just to put this into context outside of climate change, there are huge environmental impacts from our food and agricultural system. So as we've talked about, by some estimates, about 26% of our greenhouse gas emissions come from food. 50% of our land use changes. So 50% of the world's habitable land is currently being used for agriculture. 70% of freshwater withdrawals are happening because of our current food system. Eutrophication, that means pollution of our freshwater and oceans. So if you're in a place, I'm in Georgia, if you go to the coast, you will sometimes suffer from algal blooms, toxic algal blooms. I hear that happens up in the Great Lakes as well. And a lot of that is coming because of runoff from our agricultural sector. And then we've also talked about mammalian biodiversity. So biodiversity loss from the current way our food system is set up. I'm not going to get too much into the weeds here, but food waste is another major concern. If it was its own country, it would be the third largest emitting country in the world by some estimates. So not necessarily in our purview or not necessarily a prescription that we often think about with our patients, but something to consider as you're really thinking about your nutrition and food as medicine prescriptions with a climate lens. So now getting to the good part, the power of our plant-based prescriptions. So really important for us to recognize that when we are in our offices or we are in our homes, shifting our diets towards plant-rich foods, what we're doing has a massive impact on the health of the planet. It's not something that kind of maybe changes greenhouse gases on the margins. It is something that is number 4 on a list of 100 solutions developed by this project called Project Drawdown, where they looked at what would it take, what are the 100 solutions available to us right now to not just, when we think about that carbon dioxide curve, not just stop that curve from going up, but to actually start drawing carbon down. Plant-rich diets, number 4, reducing food waste, number 3. So what we are doing in our offices by prescribing this to patients is a massive, massive benefit with regard to climate change and planetary health. So thinking about it from a planetary health lens, when we start shifting diets, think we can look at also just land use for different diets. So the top line is showing us what the land use based on current global diet. If we were simply to cut out ruminant livestock, so for example, no beef or mutton, we would half the amount of land that's being used in our current food system. If you cut out beef, mutton, dairy, then you get to about 3/4 of the land that we use. We'd be able to reduce 3/4 of that land to produce the agriculture that we need to feed the human population. And that stays pretty stable all the way down to getting to a vegan diet. And then just a quick note on planetary health and healthy soil, again, outside of the bounds of what we would be doing in the clinical setting, but just really important for us to recognize that the way that our agricultural system is set up, it has huge implications for the health of our soil, which then in turn also has huge implications for human health. So I would love to close our time together really thinking about, so what's a concrete prescription that we can give to patients in the office that can both help us from the standpoint of a human health perspective, but also from a planetary health perspective. And I'd love to draw your attention to the Eat Lancet Commission Planetary Health Diet. So the Eat Lancet Commission was a group of 37 scientists, 16 countries, experts in agriculture, human health, political science, environmental sustainability, and they looked at the best available evidence for optimal human health. And they essentially present a diet that is very similar to what most of the population and most of our patients probably recognize as a Mediterranean type diet. This type of diet would allow us to live, would allow the food supply system to be within planetary bounds, and would optimize human health and prevent 20% or 11 million deaths annually. It's a win-win for higher income populations where you would see sort of the reductions in the plant-based, the reductions in the animal consumption would improve health and decrease costs. In lower income countries, you may still see some recommendations for animal foods or to meet nutrient quality, to meet nutrient requirements. And in general, their recommendations are that all populations should aim to reduce processed foods. So what specific, and again, I'll point you to this resource, but they have beautiful tables and charts to help understand what type of diet you should consider recommending for your patients from a planetary health lens. And I'm sure looking at this, it looks very similar to the type of plate that you are recommending. So moving people slowly toward a complete whole food plant source diet is optimal, where half the plate is fruits and vegetables, decrease the consumption of processed foods and meat, particularly red meat, and incrementally substitute meat with plant-rich foods for those who eat a very red meat heavy diet, where switching to something that is much more plant-based is really difficult. You can consider thinking about alternatives like poultry or fish, which can also be beneficial from a planetary lens. So as we sort of talked about, using the Mediterranean diet as an entry point, because most people know what that is, might be a place to start with a patient who's more interested in the human health impacts. You can also call it a planetary health diet if you have a patient who's really interested less in the health impacts on them right now, but very much activated because of planetary health concerns. And also crucial in all of this is to really think about flexibility and respecting cultural culinary traditions and food preferences so that your sustainable dietary changes are sustainable. So in terms of honoring that, the Eat Lancet Commission did identify certain recommended maximums for animal sourced foods. So for folks that really feel like they must continue to have some sort of animal product in their diet, what the commission sort of outlined as optimal would be for 2 animal products per day, which could include either 1 serving of a dairy, yogurt, milk, or cheese, with 1 serving of seafood, poultry, or egg. If it's red meat, then that 1 serving should be sort of just 1 serving in a week. And I do want to do a call out to health equity. So we, I think, all recognize that health inequity and climate injustice play a major role in the lives of our low-income and marginalized populations here in the US. Health disparities in the US are amongst the largest in developed nations, and largely they're rooted in preventable factors. Unfortunately, lifestyle-related diseases disproportionately affect low-income and marginalized populations, and these are the same groups that are disproportionately suffering from environmental and climate injustice. So when we think about climate change, there's again a disproportionate additional burden to these communities that are already systemically and systematically disadvantaged. And these communities also face challenges with regard to food insecurity, low access to healthy foods, safe spaces for physical activity, and reduced access to green space. So if we're thinking about our prescriptions, not only from planetary health perspective, but also a health equity perspective, then we can also promote health in communities by helping these communities with healthy, whole food, plant-rich diets, helping with access to those types of diets, considerations around access to green space and urban tree canopies, safe places to active transport, safe places for communities to gather, and clean environments. So I think we want to think not just about our single pillar, but how can we provide this entire sort of suite of lifestyle interventions to protect communities that are marginalized and disadvantaged, in addition to thinking about everything. So just to close, because I do want to save time for questions, just to close, we really want to think about the prescriptions that we're already giving for human health. How can we tweak or reconsider these prescriptions so that we can engage folks who are activated to be thinking about environmental and planetary concerns, and to, as a community, as a health professional community, also be thinking about all of these things with the health equity lens. So I will close there and open it up if we have time for questions or.
Yeah, definitely. Are you able to take the slides down just so we can see
Oh, yes.
you more clearly? Otherwise, we're very small, I think, on the screen. Perfect. Okay, we do have several questions. The first question asks, can you talk more about how fish farms may contribute to climate change?
Yes. So fish farming, I think that there are certain ways. So a lot of it is in sort of the cultivation and in terms of so the fossil fuels that are used in the boating and sort of the infrastructure to not just cultivate, but to basically collect and transport. So that's one piece that impacts climate change, and the other is sort of the damage to the local ecosystem, which is a planetary health concern. So your fish is interesting, and certainly I think that's a great slide to add with regards to sort of seafood. What are the safe limits and the optimal sort of types of products if you are going to incorporate fish into your diet? There are certain better ways to do it than others, but that is some of the reason that fish farming can be detrimental to climate change and play a role in climate change.
Okay, thank you. The next question is, are there any websites I can learn more about nutrition and climate change that you recommend?
Yes, so I think if the Eat Lancet Commission, they have a website and they have so many resources. They have interactive tools that help you create dietary plans for people. They help you sort of play around with your monthly dietary plan and where you might want to add, if you are drinking dairy milk, or you do want to eat a certain type of fish or poultry. They help you sort of plot out where you might be able to have them within planetary bounds for a weekly or monthly schedule. So that's one. There's another called the Gaples Institute that has a lot of great references, and I can email these references to you, Kara, so that they can be shared.
Perfect. That would be great. Okay, this is a good next question. It's how do plant-based and manufactured meats like Impossible and others fit into the picture? And I did see another question around plant milks as well, the production of plant-based milks. So it's kind of tied together. You can talk a little about that.
Yeah, so I think we were discussing this. So I think that essentially the science and the epidemiologic evidence at this point shows that there's really no clear health benefit for someone switching to a meat alternative. So, for example, I think you mentioned the Impossible, that type of product. So if you're doing that from a health standpoint, so if you have somebody that is eating a plant-based diet or you are recommending it and that they're amenable to that, there's not really a health benefit to add these meat alternatives into their diet. If somebody really wants to do this because they have a very heavy red meat heavy diet, and that's sort of their first step to shift, there are sustainability and planetary health benefits to those changes according to the evidence right now at the current scale. So I think the more evidence is coming out with regards to the carbon footprint as these technologies and industries scale up. But right now, the evidence shows, and there was a really great JAMA, I'll send you the reference for that as well, a JAMA viewpoint from a very well-respected nutritional epidemiologist that shows no great evidence for human health, benefits for planetary health as it stands right now. With regard to the other, oh yes, plant-based milks. So there is absolutely a concern about, when we were sort of talking about all of the planetary sort of limits, when it comes to water and fresh water for certain nuts and peas, in terms of the water usage that is required to grow and supply nuts for a large population. Even when looking at that, the planetary footprint of plant-based milks is less than dairy milk. So on balance, when that's another myth busting, I think people often come at you. So this may be some helpful tools in your arsenal as well. Yes, it is true that there is a higher footprint when it comes to sort of the water utilization, but still from a climate standpoint and carbon dioxide emissions and a lot of the other planetary health guardrails, dairy milk is still a bigger threat to planetary health.
Right. Okay, that makes sense. Okay, I think we might have time for one last question. So the question is, it appears that on a slide in the beginning of your presentation, ocean acidification is still in the green zone and has not moved into the yellow or orange zone. Can you please explain this?
So yes, so I think that we are outside of the planetary guardrails in many of the, unfortunately, the planetary boundaries. That slide was from 2023, so the data was from previous. We know that a lot of shifts have happened in ocean acidification and that there's a lot of risks around ocean acidification. But with regard, so we're outside of the green operating zone when it comes to ocean acidification. How far into red territory we are is still not clear, but based on the 2023 information or what was published in 2023, it still wasn't completely in the red zone. But these things, I think a lot of this, and I'm sorry, I know I'm talking a lot, so please cut me off, Kara, if you need.
No, you're fine.
When we're thinking about climate change and a lot of sort of the margins, are we at already past 1.5 degrees in global warming? Are we already past certain limits in ocean acidification? There is some discussion happening around sort of the margins. I think the key point for all of us, so that we are not feeling overwhelmed by how much there is to do and how far we've come, is we need to hit the brakes and go in reverse. So and we're definitely going faster than we want to. And I think that's probably the key message that most of us should take to heart. I think it's up to the scientists and the ocean, those who specialize in ocean acidity to really sort of play around with those details. But for us, I think the key point and the key takeaway is that when we do shift to a diet that we know that is good for human health, there are massive benefits for climate and planetary health.
Yeah, that's great. I know I said that was the last question, but I was just thinking of one more that might be good to finish with. So I know just in obviously a lot of the things that we saw are alarming on the slides. And I think all of us kind of have seen, you know, a lot of these things in documentaries and that sort of thing. But what positives have you seen in the last like 5, 10 years, maybe? That are kind of or interventions that are happening because people are really starting to take action on climate change.
So I think that one, there is massive movement in really thinking about fossil fuel and fossil fuel infrastructure. But I think what really gives me a lot of optimism is what's happening in our community, in the lifestyle medicine community, really thinking about sort of the health space. There is a case for advocacy for shifting to renewables, et cetera. But when it comes to the intersection of human health, health equity, planetary health, you really need people to think about food. And there is such a shift and such a greater acceptance of plant power. And I love your framing as a group for that, for plant power to make those shifts, and an acceptance, particularly in the US, to really make these shifts. And I think culturally that is going to have a huge impact in other parts of the world where they really look to the US to say, well, what shows wealth, what shows abundance. And just like we've exported these diets that have not been the highest quality, I think that we can really hopefully be the ones to export some of these shifts.
Awesome. Well, thank you so much for being a guest speaker with us. Your presentation was wonderful, and I know there were a lot of comments in the chat as well, just thanking you for the presentation, and we're so grateful that you were able to come and present to our community. So thank you everybody who joined, and again, we do close tomorrow with our last and final session on sustaining some of the behaviors that we've learned during the Plant Power Challenge. So if you're able to make that, we would love to have you there. And as always, the recordings will be sent to you at the conclusion of the Plant Power Challenge. So thank you so much.
Thank you so much.